Are you suffering with knee pain? Well, the physicians at Mercy Health Orthopedic and Sports Medicine Institute in Kenwood may be the answer to your sore knees. We stopped by to learn about the knee preservation you may need.
I'm Brian Chilelli, an orthopedic surgeon with Mercy Health and Cincinnati Sports Medicine Orthopedic Center. And I specialize in the surgical management of shoulder and knee conditions with a particular interest in complex knee conditions. So common athletic knee injuries can consist of injuries to ligaments such as the ACL, as well as to the meniscus. There's a medial and lateral meniscus, which serves as a shock absorber for the knee. And I would say that those are by far the most common types of injuries. But you also have various degrees of overuse types of injuries, as well as more complex, severe types of injuries to the knee. Knee preservation is something near and dear to my heart. I really have focused my clinical and academic work for my entire career with preserving the knee. And knee preservation involves really trying to keep people's own parts, to try to either delay or prevent altogether degenerative joint disease or osteoarthritis of the knee. Warning signs for the average patient includes anything really that affects their day-to-day life in regards to symptoms, including pain, swelling, any type of catching and locking. If the knee is just not feeling normal, or if it's not feeling like the other side, then it may warrant an evaluation. So we accomplish the preservation of the knee through various non-operative as well as operative interventions. We were looking at state-of-the-art kind of novel different types of orthobiologic agents. These can be injected into the knee. One of the agents that I'm looking at right now, I'm particularly interested in, is something called microfragmented fat, and it's adipose tissue. It's harvested from the abdomen, mechanically broken down, injected to the knee. And I'm actually involved, getting ready to launch a multi-center study looking at that particular injection. And there are a plethora number of studies that do support its efficacy for the management of early wearing out of the knee or early degenerative joint disease. Oftentimes, patients will have malalignment, means that the alignment of their knee or the lower extremity is not neutral or normal, and so therefore oftentimes that will require correcting that, and we do that through what we refer to as corrective osteotomy. So we actually cut and realign the bone in order to create more equal weight distribution through the knee. We can combine that oftentimes with various types of cartilage restoring and repairing procedures where we actually cultivate and grow new cartilage. So cartilage is a shiny coating at the end of the bones. And when that wears off diffusely throughout the entire knee, that is in fact what osteoarthritis or wearing out of the knee is. So through these different techniques, we're able to actually grow new cartilage within the knee. Different types of meniscus surgeries that we offer to preserve the knee really include various types of complex meniscus repair. So the meniscus is a shock absorber of the knee and really helps maintain and protect the shiny coating at the end of the bones, the cartilage. So I'm a very avid proponent of repairing the meniscus pretty much at all costs. And so the technologies and the equipment that we have nowadays is quite advanced, allows us to repair a lot more meniscus injuries that previously we weren't able to repair. In addition to that, we can perform meniscus allograft transplantations in the patients where that's indicated. It means that we can actually take a meniscus from a cadaver and actually insert it into a patient to restore that meniscus function. I really love a combination of being able to, I think of orthopedics in general, for the most part, we're able to really diagnose structural conditions and find solutions for them. And so therefore the results often tend to be tangible and real, and you get to actually see it, and it's very satisfying. I also really enjoy the thinking involved with taking care of various complex knee conditions, because there are a lot lot of complex knee conditions, when we're talking about knee preservation, they're not necessarily black and white. So it requires a lot of thinking, workup, including sometimes thorough physical examinations, special radiographs, advanced modality imaging studies such as MRI, CT scans, sometimes even a diagnostic knee arthroscopy to what I consider do inventory of someone's knee in order to get really a better understanding of the exact condition to see what the best treatment plan for that particular patient would be.